After the liposuction surgery, patient develops a lot of bruising on the area where the liposuction was done. Or in another case, after let's say the facelift surgery, patient develops a patch of black skin on his face, and then the doctor starts wondering what has happened in the surgery, whether there was anything which he didn't know about before the start of the surgery. So it's very important to have the preoperative checks before undergoing any surgery or before the doctor takes up any surgery. Hello everyone, this is Dr. Lokesh Handa. I'm senior consultant plastic surgeon practicing in South Delhi. Today I will be talking about something very important, which is the preoperative checks. That is, the doctor must know about the preoperative health of the patient, and also it is the responsibility of the patient that he or she should not conceal any information from the doctor who is operating on him or her. So what are all these preoperative checks? This includes your medical history, this includes your surgical history, the medications you are taking, whether you are smoking, whether you are alcoholic, or do you have any allergies, or you are taking any kind of supplements. Let's talk about the medical history. If a person has got diabetes, then of course the sugars need to be checked. It is not that it has to be checked preoperatively, rather in between the operation the anesthetist checks the sugar levels regularly so that there are no fluctuations in the sugar levels, and the recovery is fine from the anesthesia as well as from the surgery. Also, let's say if a person is having a heart disease, or he is having a high blood pressure or a thyroid disease, and if the patient doesn't think that, oh, it is not very important for me to tell about thyroid because it is normal, my tests are getting normal, but it can create a problem in the recovery from the surgery or from the anesthesia. So it's again very important to tell your doctor about all the medical history that you are having. Another important thing is the medications that you are taking. If you're taking blood thinners and you have not informed the doctor about the blood thinners like Ecosprin, then if the surgery is performed, you can have a lot of bruising, or there can be a lot of bleeding from the surgical site, and doctor is not aware about your preoperative medication, then it can create a very complicated scenario post-surgery or even sometimes during the surgery. Another important thing is your surgical history. Your surgical history, particularly if you have undergone the surgeries on the area where you are further going to take up the surgery. Let's say you want liposuction and you have not told the doctor that you have undergone liposuction before, then it can be very challenging for the doctor because there will be scars, and your doctor will not be able to give the best of the results possible. Or sometimes if a patient is undergoing nose surgery and the patient doesn't tell the doctor that he has already undergone some nose surgery before, then doctor is going to open the nose and he will find a totally different thing in the nose, and the results can be compromised. So all in all, it's very important to describe your surgical medical history as well as the medications that you're taking. Also, the history of smoking is very important, because if you're smoking, and particularly very heavy smoker, it's necessary to stop smoking, to quit smoking at least 2 weeks before surgery, and you should also not smoke post-operatively minimum 3 to 4 weeks after the surgery, because if you continue smoking, then the healing gets delayed, or even the stitch lines, they get opened up, or there can be a patches of black skin around the stitch line or other areas where the blood supply is not reached, because the smoking is ultimately compromising the blood supply to the skin. So this is again a very important thing to tell the history of smoking to your doctor. And if you have allergies to any products or any drugs, or if you're taking any supplements, like most of the people, those who are gym freaks, they take some supplements, food supplements, and sometimes they are not even aware of what supplements they are taking. Or in fat people where we are doing liposuction, they are taking some medications to reduce the amount of fat in the body, but these medications they can be blood thinner also, so they can create complications in the post surgery period. So all in all, again, very important to tell about the history of smoking, history of alcohol, any allergies or any supplements that you are taking. If you have any further queries regarding preoperative checks, then you're most welcome to call us at the number mentioned, and me or my team will be willing to help you out. Thank you.